Assalamu alaikum students. Today we have the session of the model study in which we are going to discuss the things that has been covered in the lower limb till now, and for that today we will discuss gluteal region and hip joint. Right. So, first of all I will jump into the gluteal region. Now, as you all people know that gluteal region is present in the posterior aspect of the lower limb. It is basically a transition part that separates the that is present between the trunk and the lower limb, commonly known as buttocks. It is marked by the inferior gluteal fold and superior gluteal fold. Right. The gluteal region has been divided into two type of, or you can say into two group of muscles. We have superficial group of muscles and then we have deep group of muscles. In the superficial group of muscles, we have three main muscles, that is gluteus medius, gluteus maximus and gluteus minimus, of which gluteus maximus is the largest muscle and it is the most superficial muscle. As you can see, this is the gluteus maximus muscle. It is arising from the ilium and is inserting itself on the posterior aspect of the femur on the gluteal tuberosity. This is the muscle that is supplied by the inferior gluteal nerve and is the most powerful extensor of the hip joint, but it comes into action when it has to extend the thigh against some force, like during the climbing of the stairs or during running, or when a person is standing from the sitting position, that is when the thighs are already flexed and the person has to extend the leg. Now, if you remove the gluteus maximus, then you can see the other muscles of the gluteal region. Now, I have removed the gluteus maximus muscle so that you can have a look on the deeper muscles of the muscle, but before that you can have a look on the gluteus medius muscle, which is again arising from the ilium between the anterior and superior gluteal line. It arises from the anterior superior gluteal line. I am sure you people have gone through it in the hip bone, and it gets attached to the greater trochanter of the femur. And then we have gluteus medius, which is gluteus minimus, which is not visible in this model. Right. Now, this muscle, now from here we have the deeper muscles of the gluteal region. It is, I will name it from superior to inferior. First of all, we have piriformis muscle, then we have superior gemellus muscle 14, the number 15 is obturator internus, then number 16 you can see this is inferior gemellus muscle, and in the last number 17 you can see is the quadratus femoris muscle. Now, this fan shaped muscle fibers, all of them are the deeper muscles of the gluteal region. The first one, which is the piriformis, I am sure you people have gone through it. It is arising from the sacrum and the coccyx. It is arising from the sacrum and coccyx and it moves towards the greater trochanter. The superior gemellus again is arising from the ischial spine. It also moves towards the greater trochanter, gets attached onto the greater trochanter. Obturator internus, as the name suggests, arises from the obturator membrane and the bony part that is surrounding that membrane. It also gets attached to the greater trochanter, and inferior gemellus also gets attached to the greater trochanter while it arises from the ischial tuberosity. Now, all these muscles are attached to the greater trochanter. The last one is quadratus femoris, which is arising from the pubis and is attaching itself to the quadratus tubercle that is present on the femur. Now, the piriformis muscle is the muscle that is arising from the greater sciatic foramen, and it is the important landmark in the gluteal region, as because of this muscle we name the vessels that is present above, or you can say superior to this and inferior to this. The vessels which is present superior or above the piriformis muscle is known as superior gluteal artery, and this vessel which is visible is known as inferior gluteal artery, which is inferior to piriformis muscle. Now, this is the important and the most you can say the largest nerve of the lower limb, known as sciatic nerve, arising from the lumbosacral plexus. It leaves the pelvis through the greater sciatic foramen and it enters into the gluteal region. Then it leaves the gluteal region inferior to the piriformis muscle, enters into the lower limb posteriorly, and it moves in the inferior lateral direction. Right now, this is the vessel which is visible and is going to towards the head and neck region of the femur is the branch of the medial circumflex femoral artery, which is again the branch of profunda femoris, which is again the branch of femoral artery. It is responsible for supplying the head and neck region of the femur. It is one of the most important artery, and the disruption in the blood supply to the head and neck region, if it gets injured, it takes place, right. So, this was all about the gluteal region, and now we will move towards the hip joint. Now, this is the model of the hip joint. Hip joint, as you people know, is one of the largest joint of our body, which is present or which connects the lower limb with the pelvic girdle. It is ball and socket synovial joint, ball being the head of the femur, while the socket is the acetabulum of the hip bone. Right. Now, first of all, before going into detail of the hip joint, you people should know that how the joint is formed. This is the hip bone. The acetabulum, we will focus on the acetabulum of the hip bone. Now, the acetabulum of the hip bone, whole of the acetabulum does not forms the joint. It has a central depression which is known as acetabular fossa, which does not forms the articulation with the head of the femur. While there is a lunate shaped surface, this is the lunate shaped surface which forms the lunar surface or articular surface of the acetabulum, and it is covered with the cartilage, articular cartilage, that is hyaline cartilage, and is responsible for forming the joint with the head of the femur. Now, you can see that this lunar surface is deficient, or articular surface is deficient inferiorly and forms a notch which is known as acetabular notch. So, this is acetabular notch, this is the lunar articular surface, and here is the acetabular fossa, which does not take part in the formation of the hip joint. However, it is attached to the ligament of the head of the femur, which is in turn present in the center of the head of the femur, a central fossa or depression in the head of the femur, which also does not take part in the articulation. So, these two parts have the ligament attached to it, and within the ligament they have the artery known as a branch of the obturator artery, which is also known as the branch to the or the artery to the head of the femur. Right. So, that is present in the ligament of the head of the femur attached to the acetabular fossa. Now, we will now talk about the ligaments and the capsule of the hip joint. Now, hip joint capsule is you can say medially is attached to the margin of the acetabulum. It is attached to the margin of the acetabulum. So, what is it? In this you can see this rim, which is visible posteriorly as well and more prominent posteriorly, is acetabular rim. Basically, it is a labrum made up of fibrocartilage. It deepens the you can say the fossa or the socket of the hip joint by 10%. Right. So, it is a fibrocartilaginous frame that surrounds the whole of the margin of the acetabulum, while as I have told you that inferiorly there is the deficiency of the lunar surface and acetabular notch is present. This acetabular notch is bridged by a ligament which is known as transverse acetabular ligament. So, this transverse acetabular ligament and the acetabular labrum, whole of them, they deepens the socket of the hip joint. Now, we will talk about the joint capsule. The joint capsule is medially attached to the again the margin of the acetabulum and acetabular labrum, and laterally it is attached to the anteriorly to the intertrochanteric line. This is the intertrochanteric line. This is intertrochanteric line. So, anteriorly it from the acetabular margin, it is attached to the intertrochanteric line, while posteriorly it is not attached to anything, but it crosses, or it is present just proximal to intertrochanteric crest. Right. So, this whole is the joint capsule. Now, these joint capsule thickens at certain areas and forms 3 intrinsic ligaments of the hip joint. The first and the foremost, the most important ligament is this Y-shaped band ligament, which is the strongest ligament of the hip joint, known as iliofemoral ligament. As the name suggests, it is attached to the anterior inferior iliac spine, and medially and laterally it is attached towards the joint capsule, especially anteriorly to the intertrochanteric line. It is a Y-shaped band, most strongest band, and the main function of this ligament is to prevent hyperextension of the hip joint. The other ligament is pubofemoral ligament. Now, pubo, as the name suggests, is attached to the obturator crest, which is a part of the pubic bone. Medially and laterally it blends with the joint capsule. Right. The main function of this ligament is what? It prevents the over abduction of the hip joint, over abduction of the hip joint. And I am sure you people know what is the abduction of the hip joint. It is when the femur moves away from the hip, right. And the third one is present posteriorly. This one, this is ischiofemoral ligament. The ischiofemoral ligament is medially attached to the ischium, and laterally it blends with the joint capsule. So, all in all, these all ligaments provides the stability to the hip joint when the weight is transferred, the weight of the body is transferred to the lower limb. This was all about the hip joint. Thank you.